And welcome back. So many updates this week when it comes to the coronavirus. Here to bring us up to speed on the medical front is our resident medical expert, Dr. Lukasz. Dr. Lukasz, let's begin with, if you are showing symptoms that lead you to believe you have the virus, what should you do?
Well, good morning, Carolyn. Step one, if you think you have the coronavirus, the automatic reflex and trigger needs to be self-isolation. Avoid being in public. That means don't go to work, don't go to school, don't be a hero. Your meeting can wait. This is too important. The next step is to call your healthcare practitioner. Tell them your symptoms, and they will instruct you what to do. The headline here is, don't just show up unannounced. You could be putting other people at risk, and this is exactly what we are trying to avoid.
Are there currently COVID-19 tests readily available in Canada for anyone who wants to be tested?
No, not for anyone who wants to be tested, but yes, fortunately in Canada, from the get-go, there have been reliable tests that have been available. And this is in contrast to the United States, who you've been hearing a lot about, who stumbled at the beginning of this now pandemic with faulty test kits. So yes, if you are looking for tests, they are here, but they have to be ordered wisely and intuitively by your healthcare practitioner. So you can't just show up and go through a drive-through like we're seeing in Korea at the moment. But they are becoming more widely available, and certainly testing is ramping up each day.
All right, bring us up to speed on where we are when it comes to the development of a vaccine for this.
Great question, Carolyn. It appears we are on track to test a vaccine on people within a matter of weeks. We are seeing scientists out of the United States, even University of Saskatchewan, China, Israel, all developing potential vaccines. But I have to stress, this will only be in a clinical trial setting to see if it's safe and effective. If all goes well with testing, reviewing, and monitoring, the projection is for the general public, a vaccine will become available in about 12 months.
Okay, now speaking of vaccines, many people are wondering whether the flu shot will offer any type of protection.
No. Point blank, no, neither will prevent you from getting this coronavirus, but where it can make a difference is by reducing the number of people getting the flu and being sick and potentially filling up our ICU beds and ventilators in the hospital. Look, my biggest fear right now is that our hospitals surge to 200% capacity like we're seeing in Italy, and our resources get so stretched beyond capacity. This is a serious worry. Imagine sick patients being turned down in hospitals because we don't have enough beds or enough space or even enough ventilators. So any prevention measure, including getting a flu shot while not stopping you directly from getting this coronavirus, remain important.
All right, a lot of people wondering, what does it take to recover from this? And I imagine the answer is different for everyone.
That's correct, Carolyn. It is different for everyone, but let's emphasize, most people do recover. Currently, there isn't a cure. In general, though, when we look at coronavirus patients, they get supportive treatment. That means fluids, oxygen as they need, medicines to reduce fevers. But what might interest you, definitely interests me, is there's places around the world, including the United States and Canada, where we are trying out different medicines, which previously were developed for the Ebola virus or even HIV, and they have antiviral properties, and they may be helping. So this is at least something to hang our hat on, and let's see how this further develops.
How will the changing seasons affect the virus's longevity?
Great question. A lot of people are speculating, but that's all we can do at this point is speculate. For example, we know with the flu, it thrives in dry and cold weather and then tends to disappear when the weather warms up. We hope, we think that this may be the same scenario with the coronavirus, but it remains to be seen. I believe it's going to take more than just weather and a change in seasons to end this pandemic personally, but time will tell. Hopefully the warmer weather and everything that we're doing right now, all the precautions we're taking, that will really curb this transmission and hopefully come to end this pandemic.
Do pregnant women need to take any extra precautions?
Long story short is we don't know, Carolyn. There isn't enough data for anyone to answer this question definitively. There have been reports that mothers infected with coronavirus have had premature births, but it's hard to know if they're actually directly related to the coronavirus itself. So despite not knowing, every pregnant woman needs to remain vigilant, fully alert, and still extra cautious at this time.
What about children?
Interestingly enough, everything I've read and seen, and perhaps you've heard this, Carolyn, suggests kids are faring much better than adults. For example, no children under the age of 10 have died, and they represent less than 1% of cases. That's great news, but we don't know why this is happening. Why are they protected? Maybe it has something to do with their immune system. This is certainly not to say, though, they aren't susceptible. So I still want to encourage people, practice regular hygiene, the hand washing. This needs to be done. Social distancing, like closing the schools with March break and everyone traveling, is the right thing to do. So children, we're about to find out, but there's something more to learn about this.
All right, you talk about social distancing. Can I go out for dinner with my husband tonight?
Yes, Carolyn. If you're in a low-risk area, and Canada and Toronto still low risk, and you can trust that people are honest about not coming in sick, then yes, you can go. But I was talking to my friends yesterday, and here is my advice. This is for larger settings. Chips and dip, not a good idea. In fact, anything that involves a communal bowl, stay away from it. Don't share your forks, your knives, your spoons. Don't sip from someone else's glass. And wash your hands for the full 20 seconds before and after meals. That's the best advice at this time.
So many people wondering, when can we expect an end to this?
Let's pray that it's soon. Look, I need to reiterate this message, especially with the new levels of panic and hysteria that have happened this week. These are difficult times. There is fear, but we need to calm down. We need to think practically and rationally. Washing our hands remains a priority. Social distancing is reasonable. And most importantly, protecting our older loved ones, our grandparents, our parents, those who took care of us when we were younger. It's now time for us to do the same for them.
All right, Dr. Lukasz, thank you as always. Now, if you have more questions that you would like answered, Global News has set up an email specifically for that. Just email your questions at globalnews.ca, and our team of experts will get right on it. You can also visit globalnews.ca/coronavirus for all the latest information. We're going to take a short break here on The Morning Show. Stay with us.